So to me, there's 7 key factors when I'm dealing with somebody who is presenting in front of me after a rotator cuff repair. What's the type of repair? Most oftentimes they're arthroscopic now, but they used to do mini open repairs where there's a smaller incision in the deltoids. Not necessarily an issue now. Any concomitant procedures, slap repair, subacromial decompression, do they involve the capsule, especially in our younger people where they may get too much laxity. So that's going to affect the rehab as well. So you're going to have to understand those precautions as well. How big is the tear? In somebody who had a 1 centimeter tear, you're going to go a lot faster than somebody who had a 5 centimeter tear. So you're going to have to understand that concept. It's not just a rotator cuff repair. The tissue quality and the tissue size is going to really be a consideration for the therapist. Age of the patient, we know as they get older, outcomes are not as good. It's pretty simple. That's what the research says. So somebody who is 70 years old, I'm going to go a little slower than somebody who's 50 or 40 years old, right? Makes sense. What's the length of time from surgery? If they're 6 weeks out of surgery, I'm going to go a lot slower than somebody who is 16 weeks out of surgery, right? So again, time allows for healing in patients that are that younger, good tissue, so we can really go a little bit faster with them. And then what's the ultimate functional goal? Is this a baseball player who needs to throw 90 miles per hour? Or is this somebody who just wants to have a good functional shoulder so they can work in their garden or go to work every day and sit at their desk and just not have pain? It's a very important thing for somebody. So those are all my considerations when I'm trying to progress somebody after a shoulder surgery.